Hey guys, so this will be round two of EKG Basics 101. So real quick recap on last week, right? We just talked about like the basic electrical conduction system of the heart, right? So how the SA node tells the whole heart to beat, and how the AV node in between the atria and the ventricles holds it for a second, and then sends a signal down through the rest of the wiring to tell the ventricles to beat. And then that's how we get our P, Q, R, S, and T complexes, right? So that's how we get the guy that looks like this, right? P, Q, R, S, and T. So what we're going to talk about on this video is like how to recognize an MI. So we're going to go to the big one first. And before we get into that, we're going to talk a little bit about what I just drew here. So like last week, like I was saying, we talked about the P, the QRS complex, and the T wave. And so what we're going to do is we're going to talk about a couple other names. So obviously, like, those are the names of the bumps and the triangles. And the flat pieces, like this one right here and this one right here, they have names as well. So this guy right here, that's our PR interval. And this one right here is our ST segment. And so going to be kind of important to understand these two when we're talking about looking for a heart attack. So and mainly the ST segment, so the guy on the right there. So go ahead and erase all this, and then we will start. So let's get our patient, right? This is the same guy we're going to deal with through this whole call. And it should be pretty familiar to you from the practices that we did in class, right? So we have a 65-year-old male, and his chief complaint is chest pain. Okay? You show up there, and he says that he has a pain in his chest. It started 20 minutes ago, and before that he was totally fine. It's a heavy feeling in his chest. It radiates to his left arm, and his first vital signs are exactly what you'd expect for someone who's having a heart attack, right? So he's hypertensive, he's tachycardic, he's breathing 20 times a minute, and he's diaphoretic, right? Which so means he's sweaty. So there you go. You've got a story and a set of vitals, right? So his story is chest pain that's midline, it's heavy, goes to his left arm, and the vitals are saying the same thing. He's hypertensive, tachycardic, diaphoretic. So again, all the stuff that we've like drilled into you guys like a million times. So it shouldn't be any, this should be 101 stuff. So part of the other, again, the story and set of vitals would be a 12 lead. And so let's talk a little bit about what that's going to look like. So when your heart in the blood vessel, right, so we have our blood vessel here, when we have a blockage, and so there's no more blood flow, the blood flow stops right here, and the heart tissue itself isn't getting any oxygen, then it starts to die. And when the tissue itself starts to die, the electricity that's coming through, what we would normally do is pass through it, right? Well, now that it's dying, the electricity hits it and has to go around and continue on. And that takes more time, and that also will show up on your 12 lead. So it's going to change the way that the 12 lead looks. So let's go over that right now. So the SA node says beat, okay? And a heart attack takes place in the arteries around the ventricles. So you're going to notice that the beginning of our heartbeat looks exactly the same. And there's no changes in our P wave, which is right here, right? And there's no changes in our PR interval, the flat line afterward, right? The part that the AV node is holding. But what you're going to notice pretty quickly is that when the ventricles beat, there isn't a nice triangle anymore. So that would be normal, right? That's what we're looking for. What you're going to notice is that it goes up like this, it comes down and then goes like that. And what we're really, really concerned with is this part right here. So if you notice, that part didn't come down to the baseline. And the baseline is, again, this portion right here, that flat, that no electrical activity, right? So what it should look like is it should look like this in the normal heart, right? P wave, pause, QRS complex, pause, T wave. But you can notice in the one above that the ST segment, right, this part right here that we talked about a second ago, the ST segment is what we call elevated. So it's up, it's higher, right? So to demystify a word here, if you've ever heard this, STEMI, the STEMI simply stands for ST segment, elevation, myocardial infarction. So what it's saying is that the ST segment right here is elevated above the baseline. So sometimes what you'll hear people say is, I'm going to draw it again here without the red line. So we'll draw the morphology of a heart attack. Right? So some people will say that's like like a tombstone, or they'll say it's an old school fire helmet. So if you know what the old school fire helmets look like, they have the big shield in the front and the big rounded top. So whatever helps you kind of recognize it. But the point is, when you're looking at it, you notice that when the QRS starts, it never returns to the baseline until after what is actually the T wave up here. So without overcomplicating it, it is really that simple. So if you were to see and we'll get into this in different videos, but there's leads that look at certain parts of the heart. And so there's usually two leads look at the same portion of the heart. So if in two of the leads that look at, say, the lateral part of the heart, if those two leads look like this right here, then with ST elevation, then I'd say, okay, this person's having a heart attack, right? Especially when the person, like we were dealing with here, the 65-year-old says he has chest pain, he's hypertensive, he's tachycardic, he's diaphoretic, which are all things we're going to give aspirin and nitro to anyway, right? Like this guy is already, in my mind, like having a heart attack just before I even look at the 12 lead. The 12 lead just tells us that's the case for sure. So we're looking for, again, for that ST elevation. Now, something super important to remember is this guy down, is this whole guy down here. So it's possible that we have the exact same patient, our 65-year-old male that we have above here, but his 12 lead looks exactly like the bottom one here that's circled in red with no ST elevation at all. So what do we do with that? Like, the guy's hypertensive, he's tachycardic, he's diaphoretic, he tells me he has chest pain that radiates to his left arm. It's everything I was taught about in school that says this guy's having a heart attack. But then the 12 lead looks fine. So, again, this job's pretty simple. The 12 lead is just a tool. And the tool's not telling me he's having a heart attack, but it doesn't mean he's not. And so we're going to go ahead and give him aspirin and nitro, even though he doesn't have ST elevation. So as a medic, that's going to change my phone call a little bit when I call the doc, but it's not going to change my treatment. The treatment's still the same. And so kind of like we've talked about in class, like there's not one thing from your OPQRST or sample or your vital signs that absolutely sinks it, right? There isn't like this one, for example, we talked about like pressing on the chest. Well, just because you press on the chest and it hurts doesn't mean they're not having a heart attack. So there's not one thing, and the 12 lead is like this as well. It's not the slam dunk thing that you think it is. Now, this isn't always the case, but safe to say at a very basic level, if they have ST elevation, they're having a heart attack. So it's going to be very, very rare, except for very few circumstances, where they would have ST elevation and not be having a heart attack. But, for a very basic level, right, as like an EMT, if you want to be able to look at a 12 lead and say, hey, is he having a heart attack? then what we want to look for is that this morphology right here on the EKG paper. And my guess is if you were to pause this video right now and go to YouTube and type in 12 lead EKG MI or heart attack, you would instantly be able to recognize which ones look like the guys circled in red. Does it look like an old school fire helmet? Does it look like a tombstone? Or better yet, can you recognize that there is ST elevation right here? And if you can, then good. Then you can recognize if the person's having a heart attack. Just like we talked about in class a lot of times, 90% of this job is just being a good EMT. And so what's different here that I talked about? Our medications? No. Our questions? No. The signs and symptoms? No. The only thing that's different is I look at the 12 lead and I can see ST elevation or not. And even if there is no ST elevation, what did I just say? Well, we're going to give them aspirin and nitro anyway. So, as an EMT, you can pretty much tech a heart attack the exact same way I would. I just have, medics have one more tool in the toolbox. And, it's great to have, but it's not necessary. So yeah, that's real basic, right? ST elevation. Also, we're going to write on the side here real quick, ACS, acute coronary syndrome, heart attack. These are all the same thing. They're the same words. You can use them interchangeably. You can say he's having ACS, he's having a STEMI, he's having a heart attack. It's all the same stuff. Now, this is the one that we're going to want to use with patients, right? You're just going to want to be straight up with them and say, yep. So this is, what's showing is that you're having a heart attack, right? And then you explain that it's okay, you're going to take care of them. You don't want to use words like STEMI and ACS because that's way beyond most people. But we could talk to each other that way. If you didn't want to alarm the patient, you can say, yeah, I'm seeing STEMI or I'm seeing ACS, and they won't be any the wiser of what's going on until you want them to know. So we're going to do more stuff like this. We're going to talk about heart blocks, which are electrical problems. We're going to talk about bundle branch blocks, which are electrical problems, and we're going to get a little more in depth. But for this week, given this information, you should be able to go, like I said, go to Google, search heart attack 12 lead, and be able to recognize it.